So if we can do this, I mean, start from the basic. I think some of us are not taught that. See, you quoted the verse in the Bible.
Yes.
One of the rules: do unto others what you expect them to do to you. I think we're not taught right from the basic. Thank you very much. I'll just pause here because of time.
Fortunately for us, some of us are taught, but environment has a lot of influence. Help. That's why you see when we look at the communication strategy, you educate, but at the same time, you must put a system in place for monitoring. That is the gospel truth. A system must be. If people know that they are being monitored, they will change. You understand? They will behave differently. And that is what we are lacking in government hospitals. Yes.
Thank you very much, ma'am, for the lecture. I just have a comment, and also, also to HSC. I think we need, you mentioned something about breaking bad news. I think we need to hone our soft skills on that.
Education and ethics now, they are not on your skills in knowledge, because they feel you can sit anywhere in the middle of the night and acquire knowledge, and with dedication you get skills. So, but the important point he mentioned, they monitor these things. Medical students doing the exam, they put a camera on them. You want to see how they interact, whether it's the nurse, whether it's the lab person. While if somebody watches you, you do something. What we want to talk about in ethics, that you have some other superior person, being, that ever watches you, whether it is in total darkness. And if we have to wait till somebody monitors us before we do good, then the issue of ethics has failed. Because as I have said in my lecture, food regulations and so on, they take care of only 20% of what we are expected to do from our profession. So I think while it is true monitoring needed to be placed, but let us appeal to our higher conscience of wanting
the way we talk to our patients, it still needs to change. big time. I'll give you one example. We went to Massey Hospital, we were monitoring, and I guess the junior doctor there was a house officer, but just graduated. Probably didn't know we were there. The next thing we heard this woman or the husband shouting, "How dare you!" So we all ran out to see what was going on. And he had been so rude. This mother, the child was actually dying. And he actually had the nerve to tell the mother that, "You're just coming now. I'm not actually your doctor, you're just coming now. When your son is very ill, why did you come earlier?" And he denied it. But the husband said, "I was sitting here, you said it, I kept quiet." So of course, immediately, we have to say, okay, you know what? You're more or less, suspended pending investigation. Of course, he came to HSC and was begging profusely. I said, "You're a house officer and you're already starting like this." And I bet you anything, he learned his lesson. He learned his lesson. He went for one of our customer service and attitudinal change classes. And I said to him that you're going to probably make one of the best doctors ever, hopefully, if you learn from it. So it still happens. You all may, because you're all leaders, you all may be saying, "Oh, it doesn't happen." It does. And it's the most common complaints that we get. The way she talked to me. The way she talked to me. So communication, we all laughed, we all listened. It's key to every single thing that we do. It's key to every, so please, take a hold of it and pass it down to all your followers in terms of your junior health workers. Thanks.
Thank you. Anyone? Question, observation, comment? Okay. Thank you so much, ma'am, for the wonderful presentation. We learned a lot of communication tools, skills from you today. Thank you so much. So I'm handing over to my colleague, who is a special assistant to the Speaker on Intergovernmental Affairs, Sadaku Akugo, to introduce the next topic. Yeah.
Sorry, just before the next speaker will come on board, I learned one or two of us had issues with our accommodation. We've not been able to check in. Please, immediately after this presentation, we have more than 15 rooms, almost 20 rooms available, which some of us can still check in. Good rooms in Arod, Shodipo Street, Prima Hotel. So please, those are colleagues, or if you are concerned you've not been able to check in your load, maybe you came late when we have started the program, kindly just locate. There will be a bus outside to convey people to our Shodipo after the program. Thank you.
Thank you, Doc. The next lecture would be centered on patient-centered care and patient satisfaction. That lecture will be delivered by Dr. Shola Piton. Dr. Shola Piton is the Deputy Director, Health Service Commission, Lagos State. Just a brief biography. Dr. Shola Piton, like I said, he's a public health physician with expertise in health policy and management, and he currently works in the Directorate of Medical Services of Lagos State Health Service Commission. Dr. Piton served as a senior special assistant to the Lagos State Governor on health matters. He coordinated efforts amongst healthcare service delivery stakeholders, and he's helped develop and implement quality and performance improvement and human capacity development initiatives. Dr. Piton has both clinical and public health work experience, including at the U.S. Center for Disease Control and Prevention, where he worked as a research specialist supporting the work of the U.S. Community Preventive Service Task Force, that's the CPSTF. Dr. Piton is also a member of the following. He's a member of the Governing Council of the International Hospital Federation, that's the IHF. He's a member of the American Public Health Association. He's a member of the American Evaluation Association. And he's Assistant Secretary, the Association of Public Health Physicians of Nigeria. Association of Public Health Physicians of Nigeria, the Lagos chapter. Ladies and gentlemen, can we make welcome for Dr. Shola Piton, please?
Well, good afternoon, ladies and gentlemen, my wonderful senior colleagues and great friends. I want to start by Mrs. Kemi Oguyemi for all your leadership and and for I am about this. I want to also thank my permanent secretary who has just left some moments ago, Dr. Edayemo, for allowing me to thrive because patient satisfaction. I know it's something we've all heard about, we know about, like in a hospital, whether it's ultra modern, whether it's you know, a small small setting, whether it's in primary health care, in IGA, or the one in, you know, my small village, you know. So, and we agree that it's not about us really.